Our next guest is Dr. Colston Edgerton with Novant Health General Surgery in New Hanover County. Dr. Edgerton, thank you so much for taking time out of your busy days to be with us.
Thank you for having me, June.
I'm really excited about this topic because I don't know a whole lot about this. It's really interesting. But before we get into that, let's talk about your background. So where did you go to medical school?
So I went to medical school at Wake Forest, and I went to undergraduate there as well.
My kids work there.
Really?
Yeah. So you went to undergrad there too?
I did.
Really?
What we call a double deek.
Okay. So tell me about your residency and your fellowship.
So my residency was at the Medical University of South Carolina in Charleston.
Oh, MUSC.
And it was there that I first became interested in bariatric surgery. I also became interested in what we call foregut surgery, which is procedures that address conditions affecting the esophagus and the stomach, as well as advanced hernia repair techniques.
Wow. So that is really, really interesting. But if you've been in Charleston, why did you move up this way?
Well, I have always had family in the area, so my aunt and uncle and cousins were from Wilmington, and then my grandparents were in Wallace, and so we would always vacation at Topsail Island.
Wow.
So I certainly had a connection to the Wilmington area, and then I met my wife in residency, and her family lives in Wilmington as well. So it certainly kind of put it on the map for us, and following my fellowship training, which was in Boston, at Brigham and Women's Hospital, which is a teaching affiliate of Harvard Medical School, I had an opportunity to return to Charleston and was on faculty there for 2 years.
Nice.
And was very happy there, but the opportunity came up to come here for a bariatric surgery position.
Yeah. The reason I ask is Charleston is just so awesome, and if you're, there, I just wonder why you would come up this way.
Well, it was really the job opportunity.
Yeah.
The more that I learned about it and the outstanding group that's here at Novant Health, I became really excited to work with the colleagues that are here, several, fairly well-known physicians and surgeons in their fields, and that in combination with the family connections felt like it was an opportunity I couldn't really pass up, and so excited to be here.
Well, that's great to hear. So let's talk about bariatric surgery. So probably you better explain a little bit about what it is.
Sure.
And then who is a good candidate for that?
Sure. So to start out with who's a candidate, it's really based off of historical definitions that insurance companies have used over the past several decades, but it's based off of weight. So we use what's called the body mass index, or the BMI, and patients qualify if their BMI is greater than 40 or greater than 35 with certain qualifying medical conditions. And so those are conditions that are traditionally associated with what we call the metabolic syndrome, things such as diabetes, high blood pressure, high cholesterol, obstructive sleep apnea. So if your BMI is greater than 35 but you have some of those medical conditions, then you're considered to be a candidate for bariatric surgery. And so just to answer your question, what is bariatric surgery? Historically, we thought of it as weight loss surgery, but because it addresses a lot of the medical conditions that I discussed, it's really being referred to as metabolic surgery nowadays, because it's not just weight loss, but it's been shown to be the most effective treatment for many of those conditions.
I did not know that. I had not read that. That's interesting. Are these minimally invasive procedures, or are they?
They are. So when they were first starting, they were not minimally invasive surgeries. But over the past several decades, those techniques have been refined so that it's standard practice nowadays. So they can be performed either laparoscopically, which uses kind of the straight stick instruments where you're standing at the bedside next to the patient, or what we're doing more of today is robotic surgery, using the Da Vinci robot to perform the same surgeries that we kind of perfected and learned how to do laparoscopically.
Oh, that's good to hear, rather than all this open stuff. So I've often heard that sometimes people have to lose weight in order to qualify for bariatric surgery. Is that correct?
There are certain requirements based off of people's insurance companies and kind of what they mandate. So rarely is there a number of weight loss that people have to achieve before surgery. However, many insurance companies will require an attempt at medically supervised weight loss, so just using diet and lifestyle changes before they will approve the surgery right away. And so this can be a little bit frustrating for patients who maybe have tried a number of things over the years, that have been unsuccessful, only to be told by their insurance companies that they need to do something else. But that's where it's our responsibility as a program to kind of identify what those requirements are for patients and make sure that we kind of explain everything and lay it out to folks so that that journey from when they first become interested in surgery to when they actually can have the surgery is stress-free and kind of straightforward as possible.
Yeah, I would imagine that's stressful when you say, oh, but you have to lose weight first.
Right.
That would be very, very stressful. Are there common questions that your patients come to you with? Is there do they all ask the same questions?
Well, I think the kind of the first most important thing is patients not realizing that they're a candidate for surgery. So if you look at the data across the country, less than 1% of the patients who qualify for bariatric surgery actually receive it. And so that means that there's a large number of patients who might achieve the benefits, as I was saying, not just for weight loss, but also for curing some of their medical problems, getting them off of their diabetes medications, off of their high blood pressure medications, who don't really realize that they're candidates for surgery. I think sometimes they've seen shows on TV, that kind of fulfill a certain stigma that they might have. But the first step is educating patients and other healthcare providers that there's many more patients who stand to benefit from these types of surgeries. So that's kind of the first question that I get is, am I a candidate and how can this help me?
Wow. That is really interesting. What's the recovery time like?
So with essentially all of these procedures being done minimally invasively now, the recovery is often quite quick. So patients spend one night in the hospital. We're actually doing some of these outpatient where folks go home the same day. But for the most part, folks will come into the hospital at least for one night and then rarely need much in the way of pain medications after surgery. We want them to be on their feet, walking, going upstairs, exercising pretty soon after surgery. We just say no heavy lifting for a couple of weeks. And then probably the biggest recovery for these types of patients is just adjusting to the new diet.
Yeah, that's what I was going to ask you about that.
Yeah, so that's something that we really rely on preoperative education. We work closely with dietitians who go over what the expected transition to kind of a post-operative diet would be, and kind of getting used to smaller portion sizes. That really is the biggest transition for the first month after surgery. And then after that, it becomes fairly normal for folks to be used to that. Surgery is just one step of what is really a lifestyle change. And so educating patients with the help of our nutrition and dietitian colleagues it really empowers patients to be able to have the most benefit from the surgery that they can have. So if they're combining the anatomic changes that I perform with the surgery with better food selections and exercising and things like that, then patients are much more likely to kind of achieve the maximum amount of weight loss that they can, and also to keep that weight off for decades into the future.
So the treatment doesn't end with the surgery. There's lots of learning to eat the right foods and...
Right, and we like to make sure that patients go into surgery as well prepared as possible because we really don't want people to have to learn a lot on the back end and say, oh, well, if I had known that it was going to be adjusting a little bit, or I wish that I had known certain things before surgery. We really like to be upfront and honest with patients about how it might be smaller, more frequent meals rather than sitting down to 3 large meals every day. So I've had patients that are in the food and beverage industry or are truck drivers and are on the road for a long period of time.
McDonald's.
And so once they understand that and get used to it, it really not only empowers them, but I think it makes them really excited about the opportunity to kind of engage in those lifestyle changes that without surgery, maybe they had tried in the past and were unsuccessful. But again, what I like to say is that if you combine the changes that we do with surgery with that commitment, that's where patients really can have the most benefit and see the best outcomes.
That's a very interesting topic, and I hope that you'll come back again because there's just so much more to talk about. But thank you so much for coming today, and like I say, I hope you'll return.
Thank you. Absolutely. Will do.
Thank you.